In 1854, cholera was killing hundreds in London. Doctors said it was bad air. He drew a map, traced deaths to one water pump, removed the handle. The epidemic ended. He invented epidemiology. In August 1854, London's Soho district was dying. Cholera, the disease that killed by violent diarrhea and dehydration within hours, had returned. People were dropping dead in the streets. Entire families perished in days. The stench of death filled the neighborhood, and no one knew why. The medical establishment had an answer: miasma. Bad air, foul vapors rising from sewage and decay. Cholera, they said, spread through breathing contaminated air. The solution: burn fires to purify the air. Flee to the countryside, pray. But one doctor wasn't convinced. Dr. John Snow was 41 years old, a physician known for his work with anesthesia. He'd even administered chloroform to Queen Victoria during childbirth. He was quiet, methodical, and deeply skeptical of the miasma theory. Snow had been studying cholera for years, and he'd noticed something. Cholera affected the digestive system first: vomiting, diarrhea, dehydration. If it spread through breathing, why did it attack the stomach? He had a different theory. Cholera spread through contaminated water. When the Soho outbreak exploded in late August 1854, Snow saw an opportunity to prove his theory. While others fled, Snow walked toward the outbreak's epicenter. He went door to door, notebook in hand, interviewing survivors, asking one question: where did the deceased get their drinking water? The answer kept coming back the same: the Broad Street pump. Broad Street, now Broadwick Street, had a public water pump where residents filled their buckets. It was convenient, central, trusted. And according to Snow's investigation, nearly every cholera victim had drunk from it. But Snow needed proof. So he did something revolutionary. He created a map. On a street map of Soho, Snow marked each cholera death with a black bar. As the bars accumulated, a pattern emerged. Deaths clustered tightly around the Broad Street pump, radiating outward like ripples from a stone dropped in water. Families living right next to the pump. Multiple deaths. Families a few blocks away. Fewer deaths. Families who used different pumps. Almost none. The visual evidence was undeniable, but Snow dug deeper. He found anomalies that proved his theory. The brewery workers. A brewery near Broad Street had its own well. The workers drank beer, made from the brewery's water instead of pump water. Result: 0 cholera deaths among 70 workers. The workhouse. A workhouse, poorhouse within the outbreak zone, had its own well. Result: only 5 deaths among 535 residents, despite being in the epicenter. The woman in Hampstead. An elderly woman who'd moved away from Broad Street loved the taste of that pump's water so much, she had it delivered to her home in Hampstead, miles away. She died of cholera. So did her niece, who visited and drank the water. Every piece of evidence pointed to one conclusion: the Broad Street pump was contaminated. On September 7, 1854, Snow presented his findings to the local Board of Guardians. He showed them his map. He walked them through the evidence. He made his case. And he made a recommendation: remove the pump handle. The board was skeptical. The medical establishment said cholera spread through air, not water. Removing a pump handle seemed absurd, but people were dying by the hundreds. They were desperate. They had nothing to lose. On September 8, 1854, officials removed the pump handle from the Broad Street pump. Within days, new cholera cases dropped dramatically. Within weeks, the outbreak ended. Snow had been right. Later investigation revealed the cause: a cracked cesspit, sewage pit, less than 3 feet from the well. An infected baby's diaper had been washed into the cesspit, and sewage had leaked directly into the pump's water supply. The miasma wasn't in the air. It was in the water, specifically sewage contaminated with cholera bacteria, though bacteria wouldn't be discovered for another 30 years. Dr. John Snow had discovered how cholera spread, decades before germ theory, before Pasteur, before Koch, before anyone understood bacteria. He did it through observation, logic, and data visualization. But here's the tragic part. Almost nobody believed him. The medical establishment clung to miasma theory. The Lancet, Britain's leading medical journal, dismissed his work. Even after the pump handle removal, many doctors refused to accept that water could transmit disease. Snow published his findings in 1855 on the mode of communication of cholera. It was largely ignored. He continued his medical practice, his anesthesia work, his research. But his cholera findings remained controversial, rejected by the mainstream. In 1858, just 4 years after the Broad Street outbreak, John Snow died of a stroke. He was 45 years old. He died believing he was right. But he died without recognition, without acceptance from the medical establishment, without seeing his theory vindicated. It would take decades, until germ theory was proven in the 1880s, before the world finally acknowledged John Snow had been right all along. Today, Dr. John Snow is recognized as the father of modern epidemiology, the science of tracking and controlling disease outbreaks. His methods, the door-to-door investigation, the data collection, the spot map showing disease clusters, are still used today. During the COVID-19 pandemic, every contact tracer, every outbreak map, every cluster analysis traced its roots directly to John Snow's 1854 investigation. The Broad Street pump has been restored as a memorial, without a handle. Nearby stands the John Snow Pub, named in his honor. And every epidemiologist knows the story. One man, one map, one pump handle, and a plague stopped before anyone even knew what bacteria were. Here's what makes John Snow's story so powerful. He was fighting two epidemics, cholera and ignorance. The cholera, he could prove, was caused by contaminated water. The ignorance, the miasma theory, the refusal to accept evidence, that was harder to overcome. He had data. He had a map. He had anomalies that couldn't be explained by miasma theory. He had evidence, and the medical establishment still rejected him. But he kept going. He documented everything. He published his findings. He knew he was right, even if the world disagreed. And he was willing to act on his convictions, even when others thought he was wrong. "Remove the pump handle," he said. It sounded ridiculous, but it saved lives. Dr. John Snow teaches us data matters. His map made the invisible, disease transmission, visible, question authority. The medical establishment was wrong. He was right, evidence over consensus. Truth doesn't require majority vote act on your convictions. Removing that handle seemed absurd, but it worked. Legacy outlasts recognition. He died unrecognized. Now he's a legend. In 1854, London was dying of cholera. Doctors said it was bad air. The solution was to flee or burn fires. Dr. John Snow said it was bad water. He went door to door. He drew a map. Every death clustered around one pump. He told authorities, remove the handle. They did. The outbreak ended. He discovered how cholera spread, 30 years before bacteria were discovered. He died at 45, largely unrecognized. Today, he's the father of epidemiology. Every disease map traces back to his. Every time a disease outbreak is tracked, every time a cluster is identified, every time a source is found and eliminated. That's John Snow's legacy. One man, one map, one pump handle, and a method that changed public health forever. Remember Dr. John Snow, the man who saw truth when everyone else was blind, the man who removed a pump handle and stopped a plague.